Sarah, thank you very much, and thanks for those who've joined us. I want to begin by acknowledging the people who will be part of this announcement and who will be speaking as well. Dr. Rachel Devine, who is the Assistant Secretary for Health here at the Department of Health and Human Services. Gina McCarthy, who is the White House National Climate Advisor, will also be speaking. And we do have a couple of individuals who will have an opportunity to say some remarks. I know that Dr. Levine is going to mention them. I'll go ahead and mention them as well, so that way you know in advance. Dr. John Balbus, who is the interim director of the office we're about to announce, and Arsenio Mataka, who is the senior advisor for issues involving climate change here and health equity here at the Department of Health and Human Services. Let me begin, if I may, by first expressing our thoughts and our prayers to our service members and all those who are doing the work in Afghanistan to save lives and help those who have helped America. I also wish to extend our thoughts to all those in the Gulf, in the path of Ida. We hope that they are safe, and we especially want to thank our first responders for the work that they are doing. We hope everyone is heeding instructions that are being given at this time so that we make sure everyone is protected and can return to life as normal after the storm is over. I'd like to begin by just mentioning that as Ida batters the Gulf, the West is on fire, and states like Tennessee and those in New England are recovering from devastating storms. There is no doubt that America is experiencing climate change. And there is no reason for us to doubt that we must take this on immediately, because it's not just about the climate, it's not just about our environment, it's about our health. In the 21st century, no one should have to worry about the air they breathe or the water they drink, risking their health. But too often, across our country, especially in our vulnerable communities, the threat is not only high, but disproportionately high. As we tackle the impact of this COVID pandemic, climate change continues to be one of our more difficult and threatening challenges as we go before the American people. In just the last few weeks, we have seen what climate change can do to the health of the American people. Farm workers in the fields, elderly people in sweltering apartments are dying from severe heat. Wildfires are choking people, wiping out entire towns, worsening the risks of the COVID-19 pandemic. Floods from a string of tropical storms have drowned people in the Southeast, and in my home state of California, people's taps are running dry. Reservoirs are vanishing. The alarm bells are ringing, and we can't afford to ignore them any longer. That's why I'm proud to announce the Department of Health and Human Services is adding climate change to the heart of its healthcare mission by establishing the Office of Climate Change and Health Equity. We are following through on President Biden's commitment to tackle our nation's climate change crisis and building on the work that I started when I was at the Attorney General's office in California to advance environmental justice. This is the first office of its kind at the national level to address climate change and health equity. Its mission is to protect the health of people experiencing a disproportionate share of climate impacts and health inequities, from wildfires to drought to hurricane to floods. When I grew up, I took it for granted that the air we breathed in Sacramento, California was clean. I never thought about whether it would make me sick. But I came to understand how the smog that clouded the sky in my home state posed a severe health risk to so many of us. Today, we know that increasing temperatures due to climate change will make matters even worse by increasing the number of days with harmful concentrations of smog. This is bad news for everyone, but especially for people who live in communities that have not received the full benefits of environmental cleanups and who are still being exposed to more than their fair share of pollution of all kinds. We can and we must do better by our most vulnerable communities, most importantly. For example, 16 years ago on this day, Hurricane Katrina ravaged the lives of thousands of people in New Orleans and the Gulf state. And still today in America, these same communities, like many others similar to them around the country, are still bearing the brunt of the full range of climate industry risks. We know the problems. Now it's time to get to work to solve them. The investments we make today to protect health from climate change will pay benefits for generations in terms of reducing illness and healthcare costs. This includes not just making our communities more resilient, but saving lives by reducing air pollution as we reduce greenhouse gases. The climate crisis is here. The Department of Health and Human Services is rising to meet the challenge. And now I'd like to hand it over to Assistant Secretary for Health, Dr. Rachel Devine, who will help oversee this new office. Dr. Devine.
Thank you, Secretary Becerra. I am so pleased to welcome the Office of Climate Change and Health Equity into the Office of the Assistant Secretary for Health. And I am honored to be part of an administration that is acting on the longer-term issues facing our country even as we are battling the COVID-19 pandemic. Climate change is a threat to the health of Americans right now, and that threat will only increase in the future, especially if we fail to act urgently. While we cannot for a moment take our eye off the COVID-19 response, we have seen, as you pointed out, how extreme weather stoked by climate change has added to the health threats of COVID-19 and even shut down testing and vaccination sites. We are fully aware that as we speak, federal, state, and local governments are courageously protecting others in the impact of Hurricane Ida. And as you pointed out, the coincidence of Hurricane Ida hitting 16 years to the day from Hurricane Katrina is striking. But of course, this time it's in the midst of the pandemic and fueled by ocean waters that have warmed overall since 2005. Our hopes and prayers are with the people of Louisiana and Mississippi and other impacted areas. As we emphasize our commitment to this new office's mission to protect the health of those most burdened by the health impacts of climate change, knowing many of those people are also burdened by health disparities in general and health disparities associated with COVID-19. This office will have three main areas of work. The first area will build on the resilience of communities, to health impacts of climate change, especially communities facing more than their fair share of the climate change burden. We will work closely with our regional offices to help tailor solutions that meet each region's unique needs. The second area of work will be partnering with the nation's hospitals and health systems to reduce their greenhouse gas emissions and make them more resilient to the impacts of climate change. The U.S. health sector accounts for roughly 8.5% of U.S. carbon emissions, and the global health sector accounts for around 4.5% of global carbon emissions. This effort is critically important towards meeting President Biden's goal for economy-wide greenhouse gas reductions by 2030. The last area will focus on harnessing the long-term recovery and infrastructure initiatives to combine climate resilience with health equity. We are understanding more and more how the environments where people are born, live, work, play, worship, and age can either make people healthy and long-lived or contribute to illness and health disparities. Our work is just beginning. Through partnerships and technical support and supporting training and education, the office will build the next generation of climate change and health equity leaders to continue the battle. We will meet the severe threats of the climate crisis and ensure our communities, including those bearing more than their share of the burden, don't merely survive, but thrive. I'm so pleased to recognize two individuals who have been instrumental in making the Office of Climate Change and Health Equity a reality. Arsenio Mataka, Senior Advisor for Climate and Health Equity, and Dr. John Balbus, who will serve as Interim Director for the office. And I want to thank them for their dedication to this critical public health issue. It is my pleasure to introduce White House National Climate Advisor, Gina McCarthy.
Well, thank you, Dr. Levine, and also thank you, Secretary Becerra, and congratulations to Dr. Balbus and Arsenio Mataka for all of the terrific work that went into making this office a reality. You know, I think for too long, folks have been looking at climate change as an issue that really didn't matter to them, or that they themselves individually make a difference. And I think when you look at the challenge of climate closely, you'll see that it impacts our health every single day. And people are beginning to see it and feel it. As the Secretary indicated, the evidence of climate change is now right in front of us with the wildfires and the droughts and the heat stress. Climate change is now beginning to be recognized as the most important public health challenge of our time. And this office is fully prepared and ready to tackle that challenge in ways that are going to engage healthcare professionals, make their voices heard, allow them to make a difference in the world by looking at how they are working with communities, like with seniors who need to be protected when high heat threatens their very lives, when communities need to understand how they can protect themselves and their kids from challenges of air pollution, when we take solutions already available and we amplify them across the entire federal government, which is exactly what's happening as we speak in Congress on the Hill, who are gearing up to pass both the bipartisan infrastructure deal and the full Build Back Better agenda that is going to deliver billions of dollars in investment in a safe and sustainable climate future. That's what this HHS office is going to be able to allow us to communicate with families so that climate change is no longer perceived as a planetary problem that most of us can only wring our fingers and hands about, but it's going to be about people, about their well-being, about kitchen table issues, about keeping food on the table, getting kids safe water to drink, good housing to live in, and most especially making sure that the communities that are most vulnerable, the poor and people of color and tribal nations, get their fair share of the benefits, particularly the health benefits that they so desperately need as these actions are taken. Look, I know that all of us read the IPCC report, the International Panel on Climate Change. They're looking at the science. Well, we now have a president that doesn't just look at the science, but follows it. That is what this is all about. And my excitement is that I think with this office, we can engage medical professionals. We can talk to people where they are today about their kids' health and their future, and we can maximize our ability through investments in our communities to actually bring equity to the table in our actions to address climate change. Look, climate change has never been about the planet. It's been about its people. And the biggest motivator I know for people to change and to act is their own health and the health of their families. So as a grandmother of three, I thank Secretary Becerra, I thank Dr. Levine for all their work, because I know it's going to be a benefit to my children and grandchildren's future moving forward, that we have this vital office established and active and engaged. So thank you, everybody.
Thank you so much. And at this time, we will open the call to Q&A. I see that some folks have already lined up to ask questions, so we will turn first to Ricardo Alonso Zaldivar. But before we go to you, Ricardo, I just want to mention we would like to keep the first sets of questions focused on the topic at hand, and then if we have time, we will get to other questions. Ricardo, over to you.
Thank you for taking my question. Can you hear me?
Yes.
Okay. Yes. Can you elaborate, Dr. Levine, Secretary Becerra, can you elaborate on how HHS is going to get the hospital sector to reduce its carbon footprint? Are you envisioning requirements, regulations? How are we going to see the agency go about this?
Well, thank you very much for this question. I'll start, and then I'd ask Arsenio Mataka to elaborate. Well, we've already been in touch with health systems and with hospitals about working together to decrease their carbon footprint. We have the participation of a number of different hospitals and health systems. They're going to be working on this effort, and I think that we're going to get great collaboration. I think it is not only in the country's best interest, it is not only in terms of the health of our nation's best interest, but it's in their best interest, and it's in their best interest economically to do this. Arsenio?
Arsenio Mataka, Senior Advisor for Climate Change and Health Equity. I would say that all the levers, to encourage that would be on the table. Those include levers of incentives. We know that certain folks, especially some health systems, will require incentives or investments in order to achieve those goals. Other powers that we have are regulatory, administrative, guidance. All those things working together can help us hopefully move these health systems into net zero emissions very, very soon. I would also add, though, that we are working closely with the National Academy of Medicines, who is convening with us all kinds of folks from the health sector all the way to the supply chain folks that we're speaking with and discussing these matters to have a more coordinated approach.
Can I take a follow-up? I'm just looking for a sense of your timetable.
Ricardo, okay, let me see if Dr. Balbus wants to add anything on that, and maybe we'll respond to that.
Thank you.
Timetable as well.
Thank you, Dr. John Balbus, Interim Director of the Office. The only thing that I would add is it's, of course, a very strong priority of the Biden administration to be cutting emissions from the federal sector, and the federal sector runs many of the nation's biggest health systems in the Department of Defense, the Veterans Affairs, HHS has the Indian Health Systems. So part of our public-private partnership will be bringing best technologies, best practices from the federal sector, which will be working on this at the same time as the private sector, and then, as Arsenio said, to be providing technical assistance and using all the levers that we have to make it easier for the private sector.
Thank you. At this time, if anybody else has a question, just a reminder to please press *1, and when you speak, when we call on you, please be sure to remind us of your outlet. At this time, we will call on Robert King.
Hi, this is Robert King with Fierce Healthcare. I wanted to see if I could drill down a little bit more on the levers that you want to use. Are you talking about, could you potentially cut Medicare payments to hospitals that don't cut their carbon emissions?
This is Xavier Becerra. So I think, as Mr. Mataka said, we're going to use every tool at our disposal to try to move this. And if I can give you a quick example, when I was Attorney General in California, we saw how communities were being impacted by the types of projects that were really having impact on the environment. And so our Environmental Justice Bureau went out and started to look at proposals, projects that would impact communities dramatically. And we went to see if they were following the law, and the environmental impact report laws and so forth. And what we found is it was as much an effort to communicate with local governments who were proposing development projects as it was trying to work with those entities that were going to have the direct impact on the environment. And so we found that the greatest success we had was when we reached out to a local community early on to talk to them about what the requirements were in moving forward a development project which might have severe impacts on the nearby community. So if you're planning to build a large transfer station, warehouse, you're going to have large semi-trucks going in and out on a 24/7 basis. If you are located right next to a residential community or a school, you're going to be spewing toxic diesel gas exhaust every day, 24/7. And that has an impact on those who neighbor you. So we just wanted to make sure that local governments understood what they were proposing ahead of time. And what we were able to do without having to go to court all the time was help these local governments make changes in the proposed development before it was necessary to go to court to show that they had violated the law in trying to permit that type of construction and development. We'll do the same thing here with this office at the Department of Health and Human Services. We'll reach out. We're going to make sure we reach out to every sector. Obviously, the previous question asked about hospitals, but we're going to reach out and we're going to explain to them what the law requires and what our authorities permit and where the president would like us to go. But I will say this, we will use every authority to its greatest advantage because it is time to tackle climate change now. And if we think there's a way to do it, and if we've got tools and authorities to make it happen, we will move. I don't know if anyone else wants to answer.
No, sir.
Next question.
Okay, thank you. At this time, we will move to Stephanie Ebbs. Stephanie?
Thank you. This is Stephanie Ebbs with ABC News. I just wanted to follow up on that question, or your answer from the Secretary. What authorities would the office have, or how do you see it playing out to get this office involved in some of these decisions at the local level that could be exposing communities to increased levels of pollution? Is it an additional review process? Is it education? Can you just explain a little bit more about how that might work?
Yeah, we are in the process of exploring exactly where this novel office, because again, it's not been done before. But we know there are authorities. Our job is to protect the health of the American people. Our job is to make sure human services are provided. And our job certainly should be to prevent health impacts from ever occurring. And so we will do everything it takes to make sure that happens. If you are lacking clean, potable water, we want to make sure it's because it isn't a result of man-made activity. We want to make sure that it's not being done in violation of existing law, including existing state law. So we will look for our authorities. I'm going to turn to either Dr. Balbus or Arsenio Mataka, or certainly Secretary Levine as well, if she wishes to answer. But my sense is that what we're going to do is we're going to have to try to bring together all the authorities we have under our current jurisdiction to protect the health of Americans, to make sure we drive this real challenging effort to try to tackle climate change and protect health. But let me see if we have some folks who wish to answer further.
We're going to go gradually more and more granular. So, we want to work across the department under the Secretary's leadership of Health and Human Services. So we'll be working with many of the other divisions in terms of the levers that they might have. So that would include CMS. It might include HRSA. Might include the Indian Health Service. We're going to work with CDC and NIH. We're really going to work across Health and Human Services. But in addition, with the participation and leadership of the White House and Gina McCarthy, we're going to be working with other departments in the administration, certainly EPA and Department of Transportation and others. So I think that this office will be small but mighty and will have really impacts across the department, but across the administration as well. Arsenio?
Arsenio Mataka, let me give you one clear example of this. Over the last month, 200 or more people died in the Pacific Northwest. All accounts, many of them did not have air conditioning. It just so happens here at HHS we do have programs, whether it's at CMS or through the LIHEAP program, that address or help to increase the availability of air conditioning to folks, especially folks who need it the most, those vulnerable with underlying health conditions, those that are poor and may not have a lot of money in their pocket. And so as the Secretary and Assistant Secretary just mentioned, it's that type of landscaping where you take a broad look at the programs, you figure out where can that program improve the manner in which people who are suffering now address or have to deal with the impacts of climate change. And to the extent that those programs can be improved, can be modified in order to put people in better shape to deal with that, we're going to try to do that.
Thanks very much. Just to put a little more detail into this, Our office is indeed very small. We are not bringing unique regulatory authorities in any way, shape, or form, but we are bringing several other things. We're bringing subject matter expertise. We're bringing an understanding of the data and the science behind a lot of this. And we're bringing a lot of collaborative spirit and a lot of convening power. The health sector's been behind a lot of the other sectors in terms of addressing its greenhouse gas emissions. And so one of the first things that we need to do is to start doing more careful accounting to be able to understand what the primary sources are across all the different aspects of the healthcare sector. It's not just the energy systems, it's not just the hospitals themselves, it's also supply chain issues. So we'll be working in close collaboration to provide technical assistance using in partnerships with industry leaders to help do the first really careful accounting of greenhouse gases. And then from there, we'll be able to identify what are the most economically viable and the most promising ways to start reducing those greenhouse gas emissions, all through careful public-private partnership. Thanks.
Thank you. And at this time, we can take just a few more questions. I will turn to Joyce Frieden. Joyce?
Yeah, hi, Joyce Frieden from MedPage Today. First of all, it's mentioned that the office will be small but mighty. I have seen estimates of 8 employees and a budget of $3 million, so I wanted to ask whether those numbers were on point. And also, you've mentioned health systems and hospitals as targets for your efforts. What about individual physician and clinician offices?
So we are launching this midstream. We are in the existing fiscal year, and so we had to try to juggle best we could, but we intend, as we said, to have the little engine that could grow as it develops its authorities and it expands its reach. I don't think this office is going to go away. This office will become a permanent fixture within HHS, and it will grow because the need, the challenges are absolutely there. And so as we continue to receive support from Congress to allocate resources to this particular task, we will have an opportunity to grow. But one way or the other, we're going to find the resources to make this work happen because it's too indispensable not to. By the way, a quick example of how we can do things. NIOSH, which is the occupational health side of HHS working with the Department of Labor, we often do a number of projects to research particular chemicals. Chlorpyrifos is one of the chemicals that comes to mind. It's a chemical that's used in herbicides and pesticides, and it has been found to have damaging impacts on human health. And working together with the Department of Labor, the federal government has now finally taken action with regard to this particular chemical, so that we can now say with authority that it should be removed from use in ways that could impact human health. And so there are many things that we'll get to do, and we will build on it. But now we have an office at HHS, besides the work that NIOSH does within our umbrella. Now we have one that is actually hunting for ways to do better and combine our talents and our authorities to do more. And so we're going to clearly need to up the budget, but we are starting, and I know that Gina McCarthy and the White House are absolutely supportive of this effort and have been part of the reason we've been able to have that propulsion to move this forward. We will grow because there is no choice but for us to get better and faster.
Thank you, Secretary. At this time, we will turn to a question from Ahmed at Reuters.
Hi, thank you for taking the question. Will there be financial penalties imposed on hospitals and other medical facilities that fail to meet whether emission cutting requirements or other regulations as suggested in a Wall Street Journal story this morning? And what about, if so, what about concerns over the fact that some of these measures that would contribute to failing to meet said requirements have to be taken to combat COVID-19, even if they weren't the most environmentally sound measures? Thank you.
So I'm not sure we quite understood the question. Did you ask whether or not we were going to be imposing penalties?
would you be imposing financial penalties on hospitals or other medical facilities that fail to meet emission cutting requirements or fail to adhere to other regulations established by the office? This was something suggested in a Wall Street Journal story that came out this morning.
Okay, let me repeat. We're working with existing authorities. So the only way for the federal government to impose some type of penalty would be if the authority already exists for us to do so. We're not inventing new ways to do things with authorities that don't give us the propulsion to do it. But what we will do, I think we made it very clear, is we're going to reach out to the various industries and stakeholders and speak to them as much as we can. We intend to be as transparent as we can in what we're going to do. But as I also emphasized, I'm not interested in sitting around and waiting. If the science is with us, if we have the authorities to move, and if we have done everything we can to reach out to the stakeholders involved, whether it's the industry or consumers, I've instructed the team that we're going to move, just as I did when I was Attorney General when we established the Bureau of Environmental Justice. We moved, and we don't have time to sit around. As I said, the West is burning, Louisiana is being pummeled. In one place, it's a deluge of water. In another place, there's a lack of water. Clearly, the extremes are hurting Americans and our health. So we're going to do everything we can, but we're going to reach out to the various stakeholders. We're going to be transparent in the way we do this, and we want to have partnerships because that's the best way to move. But make no mistake, if we have authorities to move, we will do everything within our authority to make things happen. I don't know if anyone wishes to add anything to that.
Okay, thank you. We have time for just one more question. We will turn to Shira Stein of Bloomberg Law. Shira, over to you.
Hi, thanks. Sort of following up on an earlier question, do you have any specific goals for carbon emissions for hospitals that you'd like them to meet?
So we're working on that now. Again, the office has been established today. We have had conversations with hospitals and health systems. As Arsenio mentioned, we have been working in a collaborative with the National Academy of Medicine, bringing all the stakeholders together. So we have not established specific metrics at this time, but we will have specific goals that we'll be working towards and that we'll be encouraging all of our stakeholder partners to work for.
And I just want to add, because I love the question, because it means people are listening and watching what this office is going to do. That's good. That's good. No one should be afraid, though, because it's in our interest to address these health impacts that climate change causes. It's in our interest to have our community stay healthy, and it's in the interest of our economy that we do this the right way. And so I'm glad folks are listening. I hope those are questions that are being posed because you're hearing some buzz out there in the stakeholder community. We want to work with the stakeholders. We want to work with everyone who will have some role in this, who will be impacted in some way by our work. This is good for America, and we want people to become our partners in this. So if anything comes out of this announcement today, I hope it is a partnership with all the sectors that are part of this effort who will be involved, understanding that I won't say there's a new sheriff in town. What I'll say is there's a new partner who wants to work with you because we need to move the ball. And so we're ready to do so, and we're going to work as aggressively and as fervently as we can. This little shop that, as I said, a little engine that could, we're going to do quite a bit. Join us and be a partner.
Thank you, Secretary. And at this time, we will conclude the call. Thank you so much to everybody who joined. If you have any further questions that we couldn't get to on the call or that you have later today, just a reminder, you can email us at media@hhs.gov. Thank you again for joining this morning.
I am proud to announce the creation of the Office of Climate Change and Health Equity within the United States Department of Health and Human Services. The office's mission is to protect disadvantaged communities and vulnerable populations experiencing a disproportionate share of climate impacts and health inequities. I'm Dr. Rachel Levine, the Assistant Secretary for Health at HHS. And this new office demonstrates the commitment of the Biden administration to both addressing climate change, which is the existential crisis facing everyone on Earth, as well as health equity. The impacts of climate change are disproportionately borne by the disadvantaged around the world and here in the United States. Many already disadvantaged communities currently bear the brunt of climate-induced risks, from extreme heat, poor air quality, flooding, extreme weather events, to vector-borne diseases. While the impacts of climate change will be felt by all Americans, they will be deeper and longer lasting among the poor, people of color, and other vulnerable populations. Addressing climate change for the long term can also lower Americans' risk of premature death and other serious health effects from air pollution in the short term. The Office of Climate Change and Health Equity will play a pivotal role in protecting our health, the health of our communities, and the health of our world.
Produced by the U.S. Department of Health and Human Services.